Hi everybody. In the last several videos we've been talking about Dr. Bredesen's ReCODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidenced in successful studies in 2014, 2016, 2018, 2022, and current clinical trials. Today, we're continuing on with the Cognoscopy. Dr. Bredesen's evaluation is screened for all the potential contributors and risk factors for cognitive decline. All of these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the very important mineral selenium. Next up, we're coming over to fasting glucose. Well, what is fasting glucose? Fasting glucose is a blood test that measures the amount of glucose, sugar, in your blood after you have fasted for at least 8 hours. It's a common test used to screen for and diagnose diabetes as well as other conditions affecting blood sugar levels. Its purpose is really to help determine if your body is able to regulate blood sugar levels effectively. Standard of care currently views anything below 100 milligrams per deciliter in the normal range. Levels between 100 and 125 milligrams per deciliter are considered pre-diabetes. And fasting glucose levels above 126 milligrams per deciliter or higher on 2 separate tests is typically used to diagnose diabetes. Now, even though standard of care views anything below 100 to be within the normal range, Dr. Bredesen and his team have seen optimal cognitive health and function with fasting glucose levels between 70 and 90 milligrams per deciliter. This is the range Dr. Bredesen recommends for prevention and reversal of cognitive decline. Fasting glucose doesn't tell us everything, but it is a good marker for our overall metabolic health. And even if prediabetes or diabetes has not been diagnosed, if this marker is outside the optimal range, it typically points to the state that precedes these conditions, which is insulin resistance. For optimal cognitive health, we're going to need the opposite of that state. We're going to need insulin sensitivity. Dr. Bredesen considers reversing insulin resistance and restoring insulin sensitivity to generally be the most important factor in helping patients prevent and reverse cognitive decline. But what is insulin resistance? We'll dive deeper on this in future videos, but here's a simple breakdown. When we eat food, especially carbohydrates, sugars, and starches, our body breaks these down into glucose. Our cells uptake that glucose for energy, but not without the important hormone our pancreas produces, insulin. Insulin acts like an escort that brings glucose to the cell and unlocks the door so glucose can enter the cell and be used up to produce energy. When we develop insulin resistance, it's like glucose and insulin show up to the cell's door, but insulin can't quite find the right key to open it. Long story short, insulin starts having more and more trouble opening the door for glucose to get into the cell. So less glucose gets into cells, which creates an energy shortage because cells have less fuel to produce energy with, and it also causes inflammation as with less glucose entering cells, more of it pools in the blood. Our brains are especially sensitive to insulin resistance and this shortfall of fuel, as they are on average only about 2% of our total body weight, but consume anywhere between 20 to 25% of our total energy intake. In fact, our brains can start to become insulin resistant before our lab markers start showing outside the normal ranges. Diminished energy supply for the brain, diminished cognitive function. There are good reasons and very good studies that demonstrate why Alzheimer's has been more and more referred to as type 3 diabetes. In fact, an American Diabetes Association study from 2004 showed that up to 81% of all Alzheimer's patients were also insulin resistant. I've linked that paper in the description below. Dr. Bredesen has found that insulin resistance is the single most important metabolic contributor to Alzheimer's disease development and progression, and that the biggest drivers that cause insulin resistance for us are diets high in simple carbohydrates such as sugar, processed food full of high fructose corn syrup, sedentary lifestyles, poor sleep, and chronic stress from work and home lives. But he also found that the antidote to reversing insulin resistance and restoring insulin sensitivity was optimizing the right diet, exercise, sleep, and stress management programs within patients' protocols. These are the core pillars of the ReCODE protocol. Again, Dr. Bredesen's optimal fasting glucose blood lab range is between 70 and 90 milligrams per deciliter. And the biggest lever in achieving this level of insulin sensitivity is what we eat every day. To learn more about this, please check out episode 16, linked on the screen and in the description below for a brief overview of Dr. Bredesen's anti-Alzheimer's diet. And I'd love to hear from you. Has your neurologist ever spoken to you about your fasting glucose levels? What do you think of this video? Please drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve. And please like and subscribe as it helps our community grow. And remember, I'm not a doctor. I don't have a PhD. I'm a caregiver and citizen researcher on the ground helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family, and see you in the next video. Thanks.